Good afternoon, everyone. Myself, Dr. Avishek Mukherjee. I reside in Durgapur and practice medicine here. I'm associated with Gauri Devi Hospital and Medical Research Institute. Today, I'll be speaking about role of sleep position in reducing nighttime acidity. So, our sleep position may play a crucial role in managing nighttime acidity and reducing discomfort associated with gastroesophageal reflux disease or acid reflux. So by making simple adjustments to how you sleep, you can potentially minimize reflux episodes and enjoy a more restful night's sleep. So, how do we do it? Firstly, we elevate the torso. Sleeping with the upper body elevated can help prevent stomach acid from refluxing into the esophagus. Consider using a wedge shaped pillow or elevating the head of the bed by placing blocks or risers under the legs to create a slight incline. Sleeping in an inclined position, such as propping up with the torso with pillows or using an adjustable bed frame, can help prevent acid reflux as gravity helps keep stomach contents in place. It is important to ensure that the upper body is comfortably elevated to avoid straining the neck or back strain while asleep. Second thing that we can do is avoid sleeping on the right side. With turning towards the right while asleep may worsen acid reflux as it allows the stomach acids to flow more easily into the esophagus. It is advisable to sleep on the left side or back instead. These sleeping positions are associated with reduced acid reflux episodes. Thirdly, what we can do is experimenting with pillow placement. Experimenting with different pillow configurations to find the optimal position for minimizing acid reflux symptoms can be done. Some individuals find relief by placing a pillow under their torso or abdomen to create a slight tilt, which can help prevent stomach acid from regurgitating upwards. Now, other things that we can do is practice of good sleep hygiene. Stress can exacerbate acid reflux symptoms, so maintaining a consistent sleep schedule and creating a relaxing bedtime routine helps promote better sleep quality and thereby reducing stress. Other things that we can do are avoiding large meals, caffeine, alcohol very close to bedtime, as these increase the likelihood of acid reflux at nights. Avoiding fatty foods and spicy foods, especially at dinner, is very important. Certain foods can trigger acidity very easily. So choosing slightly bland or non-fried food items for the last meal of the day can aid in curbing nighttime acidity. By incorporating these simple adjustments into your bedtime routine, making a few lifestyle changes, and optimizing the sleeping position can effectively reduce nighttime acidity and improve the overall sleep quality. It is very essential to consult a healthcare professional if the nighttime acid reflux symptoms are still persistent even after all these measures. So, for further guidance regarding management and prevention, please consult a healthcare professional. Thanking you for listening so patiently. Dr. Avishek Mukherjee, I'm signing off. Other things that we can take note with this role of sleep position in reducing nighttime acidity. Firstly, what we can do is, as we all discussed, as we previously discussed, that sleep position is very important, elevating the torso and gaining proper nighttime good sleep hygiene practices. The other things that we can do is use of medication. Even after using these proper hygiene and sleep practices, if the patient is not getting or the person is not getting proper relief from nighttime symptoms, then we can start medications. There are different medications that can be given. Sodium alginate has come forward as a very good option. It uses GERD. It can be used with any proton pump inhibitor, and it has very good results, which can reduce acid reflux. And other things that we can do is avoid large volumes of fluid, especially at night. Some people have a habit of taking large amounts of different types of fluids, like some drink milk, some may drink milk with coffee or a hot chocolate, maybe sometimes a very large meal. So these can be avoided as we just talked, and also having lots of water just after meal, that is also not recommended. And coming to the food, the amount of food should be low, the fat content in the food should be low, and also fried food is to be avoided. Better to take the food around 2 to 2.5 hours before going to bed. This will reduce the nighttime acidity symptoms. And some researchers also say that the patient or the person can walk after taking food around an hour or so after taking food. This will also reduce the symptoms. Sometimes there can be nighttime wakefulness in which the patient wakes up, has a severe burning sensation in the throat. There are medications available for that. If there is severe burning in the chest, or which we call nighttime acidity reflux, then immediate SOS medications can be taken. Always take guidance from the consulting doctor, and he may advise you further. Is that okay? So finally, coming to the take home points for today's topic. So after all the discussion, we can say that patients who are getting nighttime refluxes, they can avoid large quantity of food intake in their dinners. And secondly, they should avoid large quantity of fluids also just before sleeping. Also, inclination of the head end of the bed so that the nighttime symptoms are reduced. And they should always take dinner at least 2 hours before going to bed. Preferably have a small walk of 15 minutes just after taking dinner. And practice of good sleep hygiene is very important. It is very essential to avoid screen time just before sleep, like mobiles and TV screens. And always experiment with the pillow position, the best position, that is, the pillow can be under the torso or under a head, or whatever is required to properly maintain sleep hygiene. And finally, avoid sleeping on the right side. Thank you.